Doctors of Reddit, what's the creepiest thing you've encountered while on the job? RN here. I took care of a lady once. She nearly died of sepsis, blood infection. She'd had multiple strokes and coded multiple times in the ICU. They'd given her Levofed. Levofed or leave em dead is what we say because Levofed shunts blood from your extremities to your vital organs, usually resulting in necrosis, death of peripheral tissues. This means when she came to me her fingers and toes were all black. She wasn't quite right. And I've seen lots of crazy, but she truly unnerved me. She never talked, only whispered in this bright bubbly voice, like a little girl's, but she said awful things, like can you push me outside so I can chew my fingers off, and she would smile all time. She also had some really bad pressure ulcers, bed sores, from just basically being immobile for so long. We had to dress her wounds daily. She'd usually rip the dressings off pretty soon after we put them on. One night I went into her room and saw a piece of what I thought was dressing on the floor. Upon closer examination, it was a chunk of her own skin. A partially healed skin graft to be exact. Still gives me shivers. Not a doctor, but I work in a personal care home. We used to have a resident who would constantly yell out hello. Drove us a bit bonkers. After he passed away, a lady moved into the room. One night I was working a double, evening to nights. She pulled her call bell. I went in and she asked me to make him stop. Make who stop what? The old man standing beside the bed. He won't stop yelling hello. How do you just not quit your job and move to Kuwait after that? Not a doc, but I am an EMT. Honestly, old demented women holding baby dolls. They pet em and crap. That baby is real to them. Freaks me the heck out. While on an infectious disease elective, I took care of a patient with a brain abscess. The abscess had knocked out the language centers of the patient's brain, resulting in an aphasia. His words were completely scrambled 90% of the time. Ironically, the patient was a computer scientist software engineer responsible for coding groundbreaking voice recognition technology. The irony really creeped me out. I worked in an ER and the creepiest thing I can remember wasn't so much an event as a look. A 4-month-old child was brought in because it had basically suffocated in its crib due to neglect. The mother was there, watching her baby die, and maybe it was the drugs still coursing through her system. Maybe it was the shock. But watching as one of our priests tells her outside that trauma bay heaven has claimed your daughter, the glassy, 1,000 mic stare she gave as she asked if there were police going to her house and if she could go home. Something that utterly wrecked everyone an hour, and she had this otherworldly, totally distant look because she was thinking about how she's going to get busted. But some days, your faith in humanity is tested. Not a doctor, but both of my parents were, so here's a couple of the weirder stories I remember. Mum was in a doc. One night a guy came in who had tried to commit suicide. He had used a shotgun, but had stuck it under his chin instead of in his mouth and had angled it wrong so that he just blew most of his face off instead. Apparently he only lived about a block from the hospital, so he just walked over with no jaw or nose and only one eye. Basically just a couple of bloody, rasping holes instead of a face. He was in such a state of shock that he just calmly walked in and sat down in the waiting area. The other is much less gory, and mostly just weird. After retiring, Dad worked in geriatric care for a few of the nursing homes around town. One guy had this really weird affliction that I can't remember the name of, but it caused him to have really weird hallucinations, like snakes coming out of his nose and mouth. The strange part was that he was completely lucid and actually really intelligent, and my dad would talk to him frequently. They would be discussing films or philosophy, and the guy would occasionally calmly say, "Hang on a second," and then proceed to pull a 2-foot invisible snake out of his nose. He'd lay it on the ground, and then it apparently would slither away. He could talk about them and describe them in complete detail. Wish I could remember some others. There was one they told when I was a kid that had something to do with a radioactive alligator, but I don't remember the details. Also, I kind of think that particular one might have been one of those stories. A friend of mine is an EMT around Chicago. They gets a lot of calls for homeless people who die during the winter. If they don't find them quickly enough, the body cools and any exposed skin freezes to the ground. They have to scrape the people from the sidewalk before they can remove the body. A woman with schizophrenia had the delusion that men were ejaculating on her head constantly, so she would smash her noggin with rocks when available to purify herself. The repair I saw, one of many as it turns out, as this was something she did frequently, required neurosurgery for the skull cranioplastic prosthetic for the ruined skin and bone, and plastic surgery to bring the skin together just right. She had a helmet for as long as I knew her. I have never encountered a severer case of self-harm, excepting suicides, as this woman. Sad to hear as it probably stemmed from childhood sexual abuse. Nurse, not doctor, but I had a 91-year-old woman who came in with a stroke. She was unresponsive and breathing at about 44 respirations per minute, hyperventilating. This went on for about 3 days. We were waiting for grandma to kick the bucket any minute. All of a sudden her bed alarm went off. We figured it was a visitor who had leaned on her bed too hard, because that can send it off. So I don't exactly bolt to her room. When I get in there, she is sitting up, legs swung over the side of the bed, yelling I need to pee. I get her to the commode and get her back to bed. She starts bawling, saying she wants to see her husband, who is long dead. She died 2 days later. Not a doctor, but a nursing student studying psychiatric and geriatric nursing. We spend 12-hour shifts at the hospital nursing home, twice a week, and usually rotate patients. One of the things that constantly freaks me out is when a patient says something like, "I'm dying." They usually do die within a couple days, if not hours after having said that. At one of the nursing homes we did clinical at, they take this as a very serious ominous sign. I've seen this in both critical care patients and patients who are expected to discharge that same week. It's not uncommon for them to say they see their parents, loved ones, etc. and then pass away shortly after. Not saying every patient that said that has died, but I've seen enough that I take it seriously and it gives me the spooks. Not a doctor but care provider in a home for developmentally disabled adults. Some details changed for anonymity privacy. A long-time client whose mentality interests were comparable to 4-6-year-old would cover his head with the bedding when he went to bed. When staff playfully asked him what he was doing, he'd tell staff he was hiding from the ghosts. He never identified the ghosts and did this for years, so staff always thought it was just the client being playful. At one point this client didn't want to do his normal routine like eat, drink, stay up to watch television, or use the restroom. While bathing, the client said he was seeing ghosts and pointed. Staff replied, "What ghosts?" and the client said, "My mom and dad. Gonna take me home." Staff gently reminded the client that his parents had already passed away, that they couldn't possibly take him out that weekend. Within 72 hours of telling staff he saw the ghosts of his mom and dad, that client went to the ER, was admitted to the hospital, and passed away. I was the one that had spent half the night in the ER with that client. I had taken him to the ER before and other routine medical appointments. This client was known for being rather combative during such visits but was unusually peaceful the entire time. The last time he went to the ER, when I went to the client's memorial, I told the client's family that I thought he knew it was his time based on how calm he was. I didn't disclose the part about seeing ghosts of his parents shortly before the ER visit. When I was working as a critical care nurse, I sent my patient down for a heart catheterization. She was so sweet. And I remember that she and I were joking about a bunch of different things before she went down for her procedure. When she came back, she was very drowsy, as is expected from the worst, but very confused. She proceeded to have IQ psychosis due to the sedatives. Every time I would come in the room, she would throw cups of water at me and yell at me. She would make this guttural noise and tell me that I was the devil. I walked in one time, and she said, "Dear Lord, please come down and slit this woman's throat." She continued to say this kind of stuff. She told her husband that I was walking into her room with poison balls and trying to kill her. She said that my skin was falling off of my face. She scratched and hit me. It was very sad and scary. I hadn't seen this happen prior to this. We had to give her antipsychotics and restrain her initially to keep her from hurting herself. It was pretty terrible. Not a doctor, but as an EMT a few years ago I came across the most horrifying thing I've ever seen. So to set the stage a bit, it's the middle of August and it's over 90 degrees Fahrenheit, 32 degrees Celsius outside, with 70% or higher humidity. Real miserable conditions outside. We get a call to help the police with a welfare check. Basically the police knock on an elderly person's door and make sure they're still alive or need anything. This was after the neighbors had gotten worried about the over 90-year-old woman who lived in the house. She hadn't been seen in about 2-3 weeks. From what we were told, the responding officer checks all of the doors and windows and gets no response. So we pull up the contact info from our last visit to her house. The young gung-ho rookie cop got the okay to break in to check. So he goes to break down the front door. He runs up to kick it and slips as he's giving the kick and falls into a bush. He finally got it right the second time and knocked the door in. Meanwhile me and my partner are laughing our asses off at him. The next moment he set foot in the house and turned right around. He was stopped cold by the smell. That's when we knew we didn't have a patient, but a body to find. So a little more background to the environment. This house didn't have air conditioning and was sealed up tight. No windows were open or anything. Add in the temperatures outside in the previous month and you have an oven of a house. We were walking into a house that had a dead person sitting in it for over 2 weeks in an oven. So we go inside and the most horrific, eye-watering smell hits us. It's indescribable how bad it was. We could taste it was that intense. The only words I have for describing it was airborne death. So while we are gagging and trying to search the house, we finally found her body. She had been taking a bath and somehow managed to die and fall into the water. Think bony, festering, maggot soup, and that's what we saw in that bathroom. We took one look and noped the frick out of the house. I still have nightmares about that sight. And the smell. That smell comes to mind every time somebody talks about the smell of death. The ME thought that she may have slipped and struck her head and drowned. Or she stroked out and drowned in the tub. I watched a patient's heart stop on the monitor once. There are false alarms sometimes, of course. However, I was experienced enough to know that it was true alarm. I called the nurse and told her she might want to check the patient. I remember her laughing nervously to tell me that she was talking with the patient at that moment, so she could not possibly be dying. I could even hear the patient talking to her cheerfully in the background. I double checked the monitor and saw a few beats here and there and luong lines. Just as I was advising the nurse to manually check the patient, I heard her drop the phone and go, "Oh no," followed by the code blue alarm. That patient did not come back. Nurse here. Once I had a hospice patient. I went in to check on them and asked if they wanted breakfast. They said no, I'm dying. After a few minutes of assessments and small talk, I went to get their pain medication. I was gone for 10 minutes. When I got back they were indeed dead. The creepy part is that their watches stopped 5 minutes before I entered the room. A regular quartz watch. I was only gone for 10 minutes. I can't explain. Also, I checked. The pin was in the watch so he didn't turn it off. My trauma nurse friend told me she was caring for a patient who unexpectedly coded. She had to run out of the room for more supplies, and when she got to the supply closet, what she needed wasn't there. She said, frick, and got supplies she needed from somewhere else. The patient survived. The next day, she was tending to the patient who said, "You know, you shouldn't use words like that." The patient went on to explain that she saw my friend, the nurse, saying frick in the supply room. There was no way she could have. She was dead on the table down the hall, but the patient described exactly what happened as if she was there. While I was in nursing school, I did rotations in a smaller. We had done compressions on a full arrest for quite a while and the doctor finally called it. Afterwards they called it. I was asked to do post-mortem care. As I was rolling the patient with a co-worker, the patient was rolled towards me and almost up against my body as the nurse cleaned her backside. At that moment she began to vomit and she kept vomiting all over my white scrubs. Vomit sucks, but a dead lady vomiting on you takes it to a whole other level. My mom works in the local and sees a lot of interesting stuff. I'm relaying the stories she's told me. Once there was a guy who'd been stabbed who was being wheeled in and was still in shock, so he wasn't really feeling the pain yet. He was eviscerated and was holding his intestines trying to push them back in, and the docs and nurses had to retrain him from trying to do so he wouldn't damage them further. To anyone who's had bile drains like me, this will make you cringe. Guy in prison has end-stage liver failure and has external biliary drains. These are drains that are screwed into the bile ducts in the liver. He gets into a fight with another inmate, and the other inmate grabs the patient's bile drains and rips them out. Jeez, just typing that makes my stomach hurt in sympathy pain. I had bile drains for the same reason for months on end, and just a slight accidental tug on them hurt like holy heck. Patient came in with large abscess that requires lancing. Doctor goes and starts injecting lidocaine to numb the skin before cutting. As he's telling the patient just about done with the shot, boom, abscess explodes all over his face. He wears glasses so his eyes were protected, but everything else got splattered with pus and nastiness. He promptly excused himself, walked to the supply closet and grabbed a few bottles of rubbing alcohol and proceeded to get into the decontamination shower and dumps the bottles over his head. He said it took many showers to feel remotely clean again. Ugh, so gross. There's also a frequent flyer who's a very large gay guy. He always comes in complaining of rectal bleeding or bloody stool, so the doctors are forced to do a rectal exam. When they do this, the guy moans and basically gets off of the digital check. Really creepy and gross. So of course the head docs send in the residents or newer techs as a joke. One guy came back and flipped them all off, yelling "Frick all you guys," and my mom at the desk with all the docs and nurses busted out laughing. Last one for now. There was a couple who did some drug together. I think it was crack. The guy beats his girlfriend to death and they're both brought in. The guy is cuffed to the bed while the team works to try and save the woman. Meanwhile, all this guy can do is be about how he's hungry and demands a food tray or turkey sandwich. Standard hospital issue. Eventually the head doc goes in and tells him to shut the heck up, that they're not a restaurant and they don't owe him crap. It was pretty satisfying for every staff member in the air. In my early internship, a young unmarried woman was admitted to surgical ward for emergency laparotomy. Her family seemed least concerned about the agony of abdominal pain she was in. Her abdomen was opened and there was a fetus in uterus, or the tubes, I don't remember now, with evidence of instrumentation by the quacks for inducing abortion, which is illegal in hospitals in my country, resulting in uterine and intestinal perforation. The family was brutally indifferent since she had brought a bad name to them. Vet clinic story. Graphic warning. I was interning at a local clinic when I was younger and I had the opportunity to sit in on a 1U cat getting spayed. Now I have a pretty strong stomach and I've seen stuff like that before, but I was not prepared. Now the surgeon was a real fun lady. She was all about showing me the real side of being a vet. Fair enough, because to be honest, it sucks and there's a lot of nasty stuff you see do. She opens up the poor cat and announces that she's pregnant and asks me if I want to see the babies. Gross, I thought, but why not? I poke my head over and she lifts out the womb. Terrible looking stuff. She points out several lumps along it and tells me that's the fetuses. She places a small incision above one of them and then goes to squeeze one out when pop, not a fetus, but a big stream of pus comes spraying out of the womb right up onto the surgeon's face. She freezes. The assisting surgeon starts frantically getting this crap off her and I get to witness the greatest string of profanity I'd ever heard from a woman her age. Turns out the poor cat had pyometra, an infection of the womb that when undiagnosed looks like undeveloped pregnancy. Fun day. Got to go home early while they cleaned up. Don't worry, the cat was absolutely fine. After she'd cleaned off her face, she finished removing the tissue and got the cat on antibiotics. My girl was a vet tech. This dog came in that hadn't crap in a while. Owners swear the dog couldn't have ate anything. They finally do exploratory. Doctor cuts into the stomach or whatever and there is this huge eye staring out from inside the dog. Doctor pulls out a large stuffed bunny with oversized plastic eyes. I am the creepiest thing. I'm a male anesthesiologist. When I was about 40, I had a female patient about the same age for a breast biopsy. I started to sedate her with a medicine like Valium and the nurses began to drape her with her breast exposed. The surgeon was one of my favorites. A fun female who I enjoyed talking to. She often wore funny items such as cute socks. I asked her, "Any interesting socks today?" Just then my patient asked in a very distraught voice, "What did you say?" I replied, somewhat confused by the sudden outburst. "I wasn't talking to you. I was talking to the surgeon and asking if she was wearing any interesting socks." "Oh," she said. "I thought you said, any interest in sex today?" Yup. Imagine you are a 40-year female and your 40-year male anesthesiologist gives you a sedative and asks if you are interested in sex once your breast is exposed. people criticizing nurses for posting here, but they are the only ones who spend any amount of real time with the patients. I would hardly expect any doctors to have 1/8 of the stories the nurses would have of the same patients. And EMTC patients at their rawest. So although I have little experience with them, I'm sure they have plenty more stories. 2. I think this question was directed to the wrong people. Can we use a nice, general medical professionals? I just hate to see nurses get crap on. Not me, but a family friend who was an EMT got a call that a dead homeless man was found in the woods. When he went to retrieve the guy's body, they found that it had been partially eaten by something. He says there were organs trailing in different directions all around the body. Wolves, coyotes. I used to work with dogs. One of my co-workers told me about a doctor who lost his license because a woman woke up early from surgery and saw him zipping his pants and wiping her face off. The doctor got nervous and told the husband, don't worry if she says she saw some crazy stuff. It's common with anesthesia. The wife told the husband what she saw and the husband got suspicious. They drove to the police station instead of driving home and the police swabbed her face. Turns out he jacked off on her face while she was unconscious. Not a doctor, but as a nurse's aide, I can tell you that the way some people get at night when they have Alzheimer's is really weird and creepy. I worked in transport for almost 2 years. In school to be a nurse blah blah blah. The most terrifying thing for me would be one late shift in transport. We store our stretchers on an unused unit. 4th floor way in the back. Old building. We have since the start of the hospital in 1951 added to it. Now this unit used to be the old psych unit before it was shut down. It had unique room layouts and doors with windows and custom locks. Well, I was putting a stretcher back up there in the room where we store them when I just felt like I was being watched. I walked out into the hallway and asked if anyone was there. Usually a fellow transporter would sleep in one of the far rooms because he would work a morning shift but lived far away and didn't want to drive back. Anyways, no one responded, but as I stood there and surveyed the hallway, the wheelchair that was against the wall just decided to start rolling by itself a few feet as if it was nudged by something. I promptly noped the frick off that unit. I never went back alone. When I was on my OBGYN rotation, we had a patient who had to come in for an MRI scan. Usually before MRIs you have to declare if you have any metal implants. She was like, yeah I do. It's in my vagina. Turns out she had a beer bottle cap inside, and it was lodged in there for 12 years. The bottle cap was so fused to the vaginal wall that we had to use bone forceps to break off the fibrous tissue that was encasing it. After we removed that cap, we found another 2 more inside. Fun times. Trauma nurse here. Hope I may comment. Several times over the years, we've had patients who were victims of violent crime, gunshot wounds, stabbings, car versus pedestrian, arson, etc., where the perpetrator turned out to be a family member who'd been visiting them in the hospital the whole time, while the patient was comatose and said family member had not yet been named as a suspect. Some of these perpetrators turned out to be murderers, as some of the patients would go on to die from their injuries. Takes a lot to creep out a trauma team, but knowing you've been in a tiny room with a violent criminal and their victim makes you uneasy, even if you know you're never going to see them again. I'm not even a doctor, so this most likely isn't relevant, but I've spent months of my adolescence in the city's children's hospital, incarcerated in multiple wards, most prominently the psych ward. After 9 PM there are nurses on guard duty patrolling each dormitory in case anybody tries to escape and harm themselves during the night. The dormitories are very small, only 4 rooms holding up to 2 people, so it's practically impossible to get past the guard. Regardless, I kept my door locked in case. At around 3 AM I'm awoken from my slumber by breathing. I groggily disregard it, assuming that it's my roommate, before remembering that my roommate had left the day before. Nope, it's the freaking manic depressive bipolar girl who managed to sneak past the night watchman, unlock my door and watch me sleep. I have no idea how long she was there for, but she just smiled and then backed out of the room. When I woke up, there were tiny shards of plastic and glass all over the floor. That place was freaking mental, no pun intended. Dentist here. One time I had an old lady come in with a porcelain crown in a bag. She asked me if I could resmint it for her. I looked at her tooth and it was in pretty good shape. Looked at the crown and realized that it had some brown gunk in it. She reported that she had swallowed the crown and had been extra vigilant as she sat on the toilet for the next couple of days. It's okay. I soaked it in alcohol for 24 hours, she told me. Without being rude, I surmise that the brown material must have been poop. Gross, huh? Well, it gets better. In order to resmint the crown, it needs to be clean on the inside, and at the time I didn't have our fancy sandblasting air abrasion machine. I had to do it the old-fashioned way, with a drill. So here's a quick, practical dental lesson for you. A crown that has come off. Some fecal matter in it has an incredibly pungent smell. Lovingly called the under the crown smell, it is a combination of skunk, old man pits and mothballs. As you drill it out, it produces heat, smoke and dust, and smells like burning skunk, old man pits and mothballs. If you use water to minimize the smoke, it splashes all over you and then you stink like the aforementioned trio. So I elected to remove the poo and old cement without water, so at least I wouldn't smell like a Stanley steamer sandwich for the rest of the day. I took my diamond impregnated crown drill and went to work on what I can only describe as a turd hot box. My whole office smelled like someone had made an anal sacrifice to Pele the volcano god. Now, if you've ever sat next to a campfire, you'll know that smoke can make your clothes, skin, hair stink. Thus the awesome strategy of not using water as coolant backfired, and I wound up smelling like roasted dingleberries for the rest of the day. Anyway, we resmented the crown and saved her $1,000 at the expense of our olfactories. Every time we see her we think of her poo tooth headset. TL. DR. Lady ate a crown. Fished it out of her poo. We cleaned it out and glued it back in her mouth. Stunk like burning poo for a while. Back in high school, I volunteered to hang out with folks in the geriatric depth of the hospital on the weekends. There was a mix of people there. Most were pretty nice people, but there was one guy with pretty severe Alzheimer's. Completely off the grid mentally. He would throw things at nurses, hated hospital food. One day I was talking to one of the patients in the hallway and he overheard me talking and yelled at me to come talk about the weather. I said okay, and as soon as I got to the door the stench hit me and he screamed in absolute horror, "What is this?" WHO did this while pointing at a pile of feces in his bed. Nope, nope, nope. I will never work in healthcare, but I highly recommend volunteering at your local hospital to visit the aging population, because depression is rampant and most rarely have visitors. Family only visits once or twice a year. One little old lady was confined to her room because doctors were unsure what she had, but it was something bad because there was an actual biohazard warning on her door and nurses needed special masks and scrubs to enter the room. I was not permitted to see her, but she poked her head out of the door slightly once and said she wished someone would come visit her and stop being scared of her. She had tears in her eyes. I almost cried after my shift. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.